Hello, I am your host, Dr. Jack Braha, and welcome to the Medcastplus show. Here we feature local healthcare providers and physicians to give us some great tips to stay healthy here in Brooklyn and beyond. Today our guest is Dr. Andrew Winer. I am honored to have him on our set today. He is an accomplished urologist specializing in diseases of the kidney, bladder, prostate, and more. He completed specialty training at Memorial Sloan Kettering Hospital in the treatment of urologic cancers. He is currently the Chief of Urology at Kings County Hospital Center. On today's show, we will focus on the men out there and how we can treat, prevent, detect prostate cancer. So I want all the women watching today to call your husband, boyfriend, dad, brothers, and everyone else to make sure they tune in and watch today's important show. Welcome to the show, Dr. Winer.
Thank you for having me. I'm excited to be here.
Oh, it's a pleasure. It's a pleasure. This is an important topic for all the men out there, and there are many men out here in Brooklyn. Prostate cancer is on our minds. Diseases of the prostate are on our minds. And we would love to know ways that we can prevent, treat, how to detect this early, because prostate cancer is so common. So tell us a little bit about the prostate, how it functions, and why it's so important to us men.
Sure, yeah. Prostate's an interesting organ. It's a small gland about the size of a walnut, and it sits just below the bladder and just in front of the rectum. And the urethra, the tube that the men pee through, it runs directly through the middle of the prostate. And it secretes a fluid that allows the sperm to survive so that when it enters in the female, the sperm can impregnate a woman and thus have children. Interestingly, though, after reproductive years, it only causes trouble. So there's really no benefit to the prostate after reproductive ages.
So this is sort of like other organs in the body that we hear of, like the appendix that can be removed and life goes on.
Correct.
The gallbladder can be removed and life goes on. The prostate itself, after men are done having children or procreating, essentially becomes something we don't need but can cause us trouble.
Correct. It can obstruct, it can turn into cancer, can cause all sorts of trouble.
And obstruction, we're talking about when a man wakes up multiple times at night. We see the commercials on TV. Do you have a growing problem? Do you have a going problem? Is this what we're seeing on TV?
Absolutely.
Right, so this is called BPH, correct? Explain to our viewers a little bit about the growing problem that's out there.
Sure, so BPH, or benign prostatic hyperplasia, is the growth of benign or non-cancer cells within the prostate. And it essentially, if you think of it about it like your kitchen sink, it's your kitchen sink that gets clogged. And so, the urine is still being made, but it can't get out completely. And so the prostate is serving as a source of obstruction. And it causes a collapse of the lumen, or the opening of the urethra. And so not all the urine can be released from the bladder.
So basically the pipe that's draining our urine from the bladder out to the toilet is being pressed on by the walnut-sized prostate, which might not be walnut-sized anymore. It might be growing a bit
What's
bigger.
interesting, though, is that prostate cancer develops in the backside of the prostate. So while a lot of people think that prostate cancer may cause these obstructive symptoms, it actually is very rare. Only in late stages will it cause those types of obstructive symptoms.
Right, so a man watching today who says, oh, I've got no problem going to the bathroom, I can pee, I go, no issue, that doesn't mean you're clear of prostate cancer.
Correct. And that's why one of the important take-home messages today is to know your numbers.
Right, so that's another campaign we see out there with prostate cancer is know your numbers, and the number that you're referring to is called the PSA. Tell our viewers what a PSA is.
The PSA is the prostate-specific antigen, and it's a molecule that is secreted by the prostate only. And again, it has to do with the liquefaction of the semen or the sperm. And again, after reproductive years, it only serves to just utilize as a biomarker or a test that we can use to check for prostate cancer. It's a simple blood test, and we use cutoffs to determine whether or not a man is at risk for prostate cancer.
So this PSA number, when should a man watching today go to their doctor and say, hey, what's my PSA? When should I check that? What age is the right age?
Well, it depends on which criteria you're using and the risk factors of the patient. So if the patient has 0 risk factors per the AUA, or American Urologic Association guidelines, typically it's a shared discussion with your urologist or your primary care doctor. But typically we say start around age 55. In a man with risk factors, and risk factors would include three things. Age, so as they get older, more men will develop prostate cancer, but primarily race and family history. African Americans are 2 to 3 times more likely to be diagnosed with prostate cancer. And when they are diagnosed, it becomes a little bit more aggressive than Caucasians or Asians or others. And then the other risk factor is family history. So if you have a direct family member, a father, a brother, then you are at risk for developing prostate cancer. So these patients, in my practice, I typically recommend getting at least one PSA checked at the age of 45. And if it's less than 1, then they can wait another 5 years or so before getting checked again.
And this PSA test is drawn in the office. Yeah. It's a simple blood test. How long does it take to come back in general?
About a day. So you can find out the results in about a day. It's typically accompanied by the man's favorite thing, which is a digital rectal exam.
The DRE.
Oh yes, the famous DRE, where we insert a finger into the man's rectum and feel for the prostate. And as I mentioned earlier, prostate cancer develops on the back side of the prostate, and that's why you can feel prostate cancer nodules that develop.
Right. So I'm a gastroenterologist. So in my practice, when I do colonoscopies or exams, I do rectal exams, both for men and women. And for the men, we always take a nice sweep of the prostate, and often I'll feel an enlarged prostate or something that feels abnormal, and we send them over your way. And you're right, men fear that exam
more than anything.
And unfortunately, it is uncomfortable for the 20 or 30 seconds or less that it takes. But it's essential.
Yeah, I'll tell the men out there, I dislike it just as much as you do.
We don't enjoy doing the rectal exam. It's part of the business.
Yeah.
But it can really save a life.
Absolutely, it's a necessary evil.
Yeah, and that combined with the blood test in your office, within a day they get a result.
Yeah.
And combined with the rectal exam, you can give somebody peace of mind at least. Hey, listen, the numbers are okay right now. Yeah. Or if you find something, so say you have a patient who comes in, you feel something abnormal or the PSA comes back elevated, what are the next steps in detecting prostate cancer?
So you have to take into account all the different factors. If the PSA has shown a trend that's going up over time, then the next step is typically a prostate biopsy. And that's where we'll take a few pieces of tissue from the prostate and send them off to a pathologist to review. And if it comes back as benign, then everybody's happy and you can rest assured that, at least for now, there's no prostate cancer. And if it's prostate cancer, then we have to discuss various treatment options. Now, not all prostate cancer is the same. Prostate cancer tends to be a fairly slow-growing type of cancer. So of all of the cancers out there to get, it's one of the better ones to have.
If there was such a thing as a good or better type of cancer, this is slow.
But they're not all equal. So we have low, intermediate, and high-risk cancers, and they act very differently. So a low-risk prostate cancer, we may consider something called active surveillance, where we just simply monitor the patient with PSAs, occasional MRI, and potentially a repeat biopsy 1 to 2 years later. If it's intermediate risk, that means this may actually shorten a man's life. It may be the cause of his death earlier than anticipated. And so in those cases, we would recommend some intervention. And in that case, we would recommend the standard treatment options, which would be either surgery to remove the prostate or radiation options. And there's some alternative options that we can discuss later, but the standard options are surgery and radiation. And for the very high-risk ones, those are the ones that will act very, very quickly. Those you have to make sure they haven't metastasized or spread to other parts of the body. And we may need to include other treatment options such as hormone treatments and whole body radiation, etc., for those men.
So there's really a spectrum of pancreatic cancers that are really slow growing, where people might just live with them and watch and see how it goes, medium and sort of the high risk.
Yeah.
So at Kings County Hospital, where you're at, here in the heart of Brooklyn,
right,
one of our oldest, most famous hospitals here in Brooklyn, what are the options that you're using here? I hear something called a robotic prostatectomy. Does a robot do the surgery, or do you actually do the surgery? Tell our viewers a bit more about what are the options at Kings County.
Yeah, so at Kings County, we're proud to offer the latest in the treatment for both surgical and radiotherapy options. As a surgeon, I've been trained and utilized the Da Vinci robot, which we recently acquired. And one of the things that I really like most about it is the way that the patients feel afterwards. The patients recover much quicker from this type of surgery. The incisions are smaller, it's more precise, they stay in the hospital one night, and typically less blood loss and less pain. Furthermore, as a surgeon, we can see right next to the organ that we're going to be operating on, and so the actual operation is much more precise. With regards to radiation, at Kings County we offer IMRT, or intensity modulated radiotherapy, and it's also a very precise way to deliver radiation. And so we're very proud to offer the whole spectrum of treatment options at Kings County to our patients.
So patients are presented with the options of treatment, whether it's surgical, radiation therapy. Obviously, the medical therapy like hormones is more for patients where it might have metastasized.
Right.
What makes a patient choose surgery over radiation, or radiation over surgery, or is there any reason to choose one over the other?
Yeah, well, so a number of studies have shown that typically men who are younger tend to do a little bit better with surgery for a number of reasons. One, younger patients heal better. Two, radiation has a cumulative side effect profile. So over time, side effects from radiation can accumulate over a man's lifetime. So the average onset of radiation side effects is around 2 to 5 years, and it can build up even over the course of about 10 years. So this compares to surgery, where you cut somebody and they heal for the ensuing several months, and typically by roughly 6 months they're back to close to their baseline, or as close to the baseline as possible. Both treatment options affect a man's ability to control their urine and their erections for sexual activity. Now, as far as which to decide upon, that's a discussion that you'll have with your urologist and potentially a radiation oncologist. But in general, for younger, healthier patients, I tend to offer the surgical option because they return to their baseline function much quicker and don't have to deal with the long-term side effects of cumulative radiation side effects.
Right. Everything in medicine obviously has its upsides, and there are also the downsides, or what we call side effects or complications that can go on. So it sounds like it's important for the man and his family to meet with radiation oncologists, to meet with a urologist, sometimes even an oncologist in the situation, and come up with a customized plan. And at Kings County, you're able to offer what sounds to be a whole milieu of treatment options.
Yeah, we can offer pretty much the whole comprehensive package, which is very nice because rather than having to go to different facilities for specialized care, we can offer it all in one center.
And this is important because, having been in Brooklyn now myself for 15 years, taking care of people and in the practice of medicine here for quite some time, it's important when patients are able to get their care in one spot for a specific disease. And so comprehensive prostate care is available at Kings County Hospital Center with the great Dr. Winer, who we're really happy to have here today, even though he is a Brooklyn transplant, correct?
Correct, yes.
So tell me, in Brooklyn here, obviously we have a very mixed population, and you told us about African Americans, Afro-Caribbeans having a higher risk of prostate cancer. For the men and maybe the women watching today who...
Please, women, listen.
The women in the household who help provide a lot of the care, please look out for your men. What should both men and women today know about some of the scary warning signs of prostate cancer, that if someone in the household is talking about a symptom or so, what should they look out for that says, hey, listen, I got to